When we talk about the female body, breasts are often seen as symbols of beauty or femininity. But biologically, they are incredibly dynamic organs. They change constantly. Some of those changes are temporary, while others stay for good. Pregnancy and breastfeeding transform the breasts more than almost any other stage of life. During this time, they often become larger, fuller, and more sensitive. The milk-producing glands expand, blood flow increases, and the skin stretches to keep up with this rapid growth. The areola usually darkens and enlarges, creating a high-contrast visual target for the baby, while the Montgomery glands, those small bumps, help lubricate and protect the nipple. But here's the key point. While many of these changes are temporary, not everything goes back to exactly how it was before. Once breastfeeding stops, the breasts go through a process called involution. The milk-producing cells undergo programmed cell death, apoptosis, bringing the breast back to a resting state. But it rarely returns to its pre-pregnancy form. Many women notice their breasts feel softer or less firm. That's because the glandular tissue decreases and is gradually replaced with fat. The skin, which stretched to accommodate that fullness, may not completely snap back, leading to changes in shape or mild sagging. Sagging is often blamed on breastfeeding, but it's actually more directly linked to pregnancy itself. As the breasts grow and gain weight, the Cooper's ligaments, the connective tissue that supports them, stretch. Over time, this stretching can reduce their elasticity and support. Stretch marks develop when the dermis tears during rapid expansion. They may fade from purple to silver, but they don't completely disappear. The structural change in the skin is permanent. It's important to understand that these changes are not damage. They are simply the visible record of what your body has done. They reflect a powerful transformation your body created, nourished, and sustained life. Years later, another major shift occurs: menopause. Menopause marks the end of the reproductive phase and is defined by a sharp decline in estrogen. Because breast tissue is highly sensitive to estrogen, the effects are significant. During menopause, hormone levels don't just decrease, they fluctuate unpredictably. At certain times, breasts may feel heavier or more uncomfortable. As the body adjusts, the milk-producing structures, the ducts and lobules, gradually shrink and become less active. Over time, the firm glandular tissue is increasingly replaced by adipose fat tissue. As a result, the breasts often feel softer, less dense, and less nodular than before. As estrogen levels continue to fall, the skin loses collagen and elastin, combined with the added weight of fatty tissue. This often leads to increased breast ptosis, commonly known as sagging. The inframammary fold, where the breast meets the chest wall, can gradually shift downward, and the nipples may begin to point more toward the floor as the internal support structures weaken. Unlike the temporary changes seen during breastfeeding, many of these shifts during menopause tend to be long-lasting. Postmenopausal breast enlargement is also a common source of frustration. Many women feel surprised or even concerned when their breasts become larger after menopause, but this is actually quite common. As estrogen levels decline, glandular tissue shrinks and is steadily replaced by fat. At the same time, metabolism slows, and the body may store fat overall, including in the breasts, making them appear larger, softer, or heavier. While this can feel uncomfortable, it is a normal part of aging, not a health problem. Every woman's experience is different, but regular exercise and a balanced diet can help reduce overall body fat, which may also lead to a decrease in breast size. Breasts are not static. They evolve through every stage of life. From nourishing a newborn to adapting to hormonal shifts later on, each change tells a story. And rather than seeing these changes as something lost, it's more accurate to see them as something gained. Your body isn't going backward, it's moving forward. Thank you for watching.